Well, more than a year into negotiations between PeaceHealth and nurses at PeaceHealth Sacred Heart Home Care Services in Lane County, still no movement. Today, the Oregon Nurses Association announcing that union members voted to authorize an open-ended strike if demands are not met in the next bargaining session, which takes place next week.
Now, ONA has also filed unfair labor practice charges. KVAL's Juliette Smith is live outside of PeaceHealth Home Care Services with more information from officials and nurses. Juliette?
Well, Brandon and Kendall, this does not mean that they're going to strike. It means that they voted to give the ONA bargaining board the authorization to call for a strike should they see fit for it. Now, this comes after they've sat through over 45 bargaining sessions with PeaceHealth officials to no avail. Now, a reminder that, to clarify, we're talking about home care nurses and not the nurses that work within the hospital. They're dangling the threat of another strike to secure equitable pay and, in doing so, increase and retain recruitment and address the staffing crisis. After their last strike, ONA nurses say PeaceHealth executives demanded nurses accept a roughly 5% lower pay than other PeaceHealth hospital nurses and nurses in their same position on the coast. An ONA communications rep says it's become a clear sign of disrespect.
They continue to offer below market wages, less than nurses at the local hospital make. In the same day, PeaceHealth had two negotiations going, one with their home care nurses at PeaceHealth Peace Harbor in Florence, one with their PeaceHealth Sacred Heart nurses. That same day, they gave nurses in Florence the exact same agreement that nurses at Sacred Heart in Eugene and Springfield have been asking for.
Mealy says one of their biggest frustrations come from the moral injury of seeing patients' needs go unmet due to the number of nurses lost throughout these negotiations. Union reps say their nurses are fed up and leaving, threatening the community's health and exacerbating the healthcare shortage. Nurse Desiree Atwater is on the bargaining team and is frustrated, so much so that she's taken on a part-time role to make ends meet.
I went back to work at the hospital because I can't afford what they're doing with wages. Like I have bills to pay. We've had folks that had trouble buying groceries over the past year because their wages are not keeping up with the cost of living here.
If a strike is called, ONA will provide our community and PeaceHealth with a 10-day notice to allow PeaceHealth executives adequate time to connect to patients with alternative care options or join them on the bargaining table. In a statement to our newsroom, PeaceHealth said in part that they're disappointed in ONA's authorization for another strike, saying their goal is to provide significant wage increases. They also provide numbers for the wage increases they're proposing. And again, ONA says this still amounts to roughly 5% less than nurses in the same role in Florence and nurses who work in the hospital facilities. Now, the next mediation session is coming up next week, and of course, we will continue to bring you updates as we learn more. Live at PeaceHealth, I'm Juliette Smith reporting, and I'll send it back to you in studio.